Welcome to AETCM, the Emergency Medicine channel. In this video, we'll be discussing about 6 P's of compartment syndrome. So compartment syndrome, as we know, it occurs when the pressure within the closed compartment of the muscle rises in an exceeding manner, and what happens is the oxygen supply and circulation to that muscle component will be reduced, so that the muscles and nerves in that component will get damaged. And if it is not identified earlier, or if you are not able to rectify the issue earlier, the patient can have serious complication, and it can even lead to amputation of that limb. So compartment syndrome can occur due to multiple reasons. The very most common reason is the trauma that can result in the fracture, or due to crush injuries, burns, vascular injuries, or if there is a tight cast in that side. So all of these can be the reasons for compartment syndrome to happen. So coming to the 6 P's. So 6 P's are basically the classical mnemonic which is used to identify the symptoms. These are the symptoms that can occur in association with compartment syndrome. So in 6 P's, the first P is for pain. So the patient will be having severe pain, and very commonly the pain can worsen with passive muscle movements. And the next P in the 6 P's is pallor, that the skin will be appearing as pale in that affected site. Next is paresthesia, so the patient will be having tingling or numbness in that site. Next is paralysis, that the patient will be having inability, the patient will be feeling weak, the patient will have inability to move that limb, that is paralysis. And coming to the next, that is pulselessness. So the distal pulse will be absent in such patients. Either it will be weak or the pulse will be absent. Coming to the last P, that is the poikilothermia, which means the patient's limbs will be appearing as cold. So it is due to the impaired circulation. So these are the six P's that that the mnemonic suggests. So first one is the pain. I'll summarize it again. So first P is for pain, which is severe pain that worsens with passive raising or passive movement of muscles. Next is pallor, that is the pain scale in that affected site. Then we have paresthesia, that is tingling or numbness sensation in that site. Paralysis, that the patient will not be able to move that site. And next is pulselessness, that is the distal pulse will be absent or weak. And poikilothermia, which means the patient will be having cold extremities due to defected or impaired circulation to that site. Thank you for watching.